Stroke can be devastating. First of all, you can die. You can end up severely debilitated in a nursing home. You can lose function, lose ability to interact with family members.
When symptoms begin, it's critical to seek help.
When a stroke begins, the brain is threatened immediately. The longer you wait, the more brain dies.
Every minute, 1.9 million brain cells lost. A race against time to limit the damage and save a life. Now, new hope for patients with the most severe strokes, available in the Northland only at St. Luke's.
We go directly to the brain and remove the clot.
It's called a stroke thrombectomy, and it doubles the chance of successfully removing the clot.
We bring the patient to our operative suite, place a fine catheter through an artery in the leg, thread it all the way up to the brain, and once it's there, we use state-of-the-art technology to remove the clot, effectively curing the stroke.
A treatment like this used to mean sending a patient to the Twin Cities, losing critical time.
So if you look at transporting the patient down to the cities, approximately an hour and a half, you've decreased their odds of a functional outcome by 36%. And that's a huge deal for stroke patients. So again, we're very, very fortunate to be able to provide that type of treatment up here.
It's this forward thinking that has earned St. Luke's repeated recognition from the American Heart Association and the American Stroke Association.
It really takes a commitment from the whole organization to support stroke care.
The sooner a patient is assessed here at St. Luke's, the better the outcome. But the first step is to recognize the signs at home.
Think fast. Facial droop, arm weakness, and slurred speech. Any of these symptoms could be a sign of stroke, which means it's time to call 911.
If you feel or a family member feels you might be having a stroke, the key is to get to the hospital as soon as possible.
You can also take matters into your own hands to lower your risk of stroke.
Major risk factors include heart disease, atrial fibrillation, obesity, hardening of the arteries, and smoking. To learn more about the stroke care offered at St. Luke's, visit slhduluth.com/strokecare.